I'm
Yeah,
going to ask
the
you this.
concept of normal, as we built this business, the concept of normal took on a whole new meaning. It's interesting because in the context of a specific patient with a specific condition, normal, especially across labs, normal isn't normal. It's very interesting. So I have a new level of appreciation for that, especially based on the context of the patient. I mean, that's the real key. Is taking a CBC in isolation is impossible. Right. I mean, what is the value? I mean, you have to know the patient, you have to know the history, you have to know what meds they're on, what kind of conditions they're dealing with. So that's what makes processing in labs really hard. And it is a complex task. And again, a great application for AI.
Another thing that you don't have to answer if you don't want to, but it kind of pains me. And I've never said this on 3 years of the podcast. I think we have a problem of over administration of testosterone from low testosterone levels, right? And we know, I'm sure you know, that very much matters on what time of day you do this testosterone. Like we know that this is simple physiology, but I've seen plenty of cases where where men my age just didn't know that mattered, or didn't know that maybe having repeat testing, or that there needs to be an access evaluation for what cues in testosterone and what's happening to the adrenal corticoid and the anterior pituitary. Like none of that stuff's done. And they don't realize that they are forever going to be dependent on testosterone without some washout period to wake up their adrenals and start doing this. And when they say that, they get horrified, right? And then also, so maybe that's not maybe these aren't alleyways that you're looking to uptake, but I think for the greater good, at one point, someday we'll be able to say, this is when it makes sense to do it. This is when it makes sense not to do it. This is when, in fact, they're turned out not to be testosterone deficient, because you have to have an explanation for that. I could see really helping. You said you didn't want to standardize or democratize. I'm going to push back and say maybe it's a good thing to recalibrate, kind of our practice behavior, because of things that just weren't capable of giving us the insights from continuous longitudinal data that they can today.
Yeah. Well, this is where it's going. So if you look at over the next 5 years and say, where does AI go with healthcare? I think we really end up with these kind of tools. We give providers an unbelievable capability to really, really help patients, and it's going to improve healthcare all the way around. So while today a lot of the AI solutions out there, you'll hear about them automating some paper process that saves time, and that's great. But moving towards this ability to equip providers with more information at the right time, at the right place, I think it's going to be the thing that changes healthcare. We've all wanted to improve healthcare for a long time. I think this is going to be the thing that actually does it.